Good afternoon, everybody. Mikhail Bedell, Vice Chair, subbing for our chairperson. This is the Lewis and Clark City County Health Board. Today is June 27th, 2024. Call this meeting to order. We'll begin by reviewing the agenda and asking if there's any revision to the agenda. Not seeing any. If we could take a minute to review the minutes from the May 23rd meeting, if you haven't already done so. Are there any clarifications or changes that anybody's noted? All right, not seeing or hearing any, we'll accept the minutes. And we'll move to announcements.
Thank you, Mr. Chair, members of the board. There are two farewells that we need to do today. The first is Justin. So as a staunch Board of Health member for the last 6 years, he has come to the end of his 2 terms that is allowable. And so even though he was begging to stay on the Board of Health for another 6 years, rules say it's time to rotate off and look for another replacement for Justin, for this position that Justin holds as a representative living in the city of Helena. But I just want to start by saying that I have so much gratitude for your leadership, and you and I lived through some hard times there for a couple of years, and you were the chair of the board through COVID. And so we really got it from all directions. And so thank you for sticking in there with me and kind of being my partner through that, and really appreciate your leadership. So
thank you.
You'll be a hard one to replace on the board. There's no doubt.
Thank you. No, it's been a great experience. I mean, I think one of the things when you asked me to be on this board 6 years ago, I can't believe it was 6 years ago. I see everything as a learning opportunity, you know, education wise learning. And it was just nice to have just continue to learn from all the board members, all the staff, about water quality and everything else. And then there was that little thing called the coronavirus that kind of took us in a tailspin for a while. Never a dull moment in those 2.5, 3 years. And I can't remember his name, that he asked me if I'd be the chair. And I was like, well, I don't know. I can't, Jim Benish.
Oh,
yeah.
That's Jim.
And asked me if I'd be the chair. And I said, well, I don't know. Hemmed and hawed. And then he's like, I think you should be. I think I showed up 2 minutes late to when we had the board meetings at the county. And all of a sudden I was the chair for almost 4.5 years.
Yeah.
So great experience, great people, great community, and it's just been a pleasure. And I appreciate the opportunity to be part of it. So,
Well, thank you for getting us through COVID in particular. It was a very difficult and challenging time. So, to be partnered with Brenda and steering the board through all of that, truly appreciated.
thank you.
Do we have other comments or good riddance?
I'll chime in. This is Bree. Sorry, I don't have my camera on, but thank you so much, Justin. And I'm happy to carry the torch for you for a few more years. You've just been an awesome mentor and leader for the years for many of us. So thanks for all your efforts and courage.
Thank you.
Yeah, this is Lisa. I would just like to echo everybody's sentiment. Thank you very much, Justin, for your willingness to stay on for the 6 years and your leadership and sort of mentorship for us new board members. I really appreciate it too.
Thank you.
This Rex, same echo sentiments. It's always comforting when we jump online or we're headed into a meeting and you're there, Justin. So super thankful that you're there.
Thank you.
Yep, you're gonna be missed. It's a good
Thank
thing
you.
you're just down the hall.
Yeah, I'm just gonna be right over
Yeah.
here.
Yeah, I'll
I don't know what I'm gonna do with my 2 hours of free time apparently.
Public is always welcome.
Yeah, oh yeah, I'm just gonna attend for fun. No,
That's right.
ask all the hard
That's right.
questions.
Well, and I look forward to our continued partnership between public health and Peerview and your mentorship in that role and in that capacity. So, yeah, Justin's not going anywhere. He's just no longer going to be on the board.
This is Commissioner Andy Shurtleff. I just want to say thank you very much, Justin, for being a good partner through the pandemic. I know it was a lot of uncertainty, a lot of fast moving pieces, but it was your work is known, and I appreciate you working with Drenda and the others and leading the board through that really tough time. So thank you very much and all the best.
Thank you.
And the second announcement and farewell, I am sad to say that our very own Jolene is headed to Georgia. She has found some excitement and has decided to go to the East Coast where it's nice and warm and the bugs are big. So this is her last meeting and actually coming up on her last week of employment with Lewis and Clark Public Health. She has been an employee with Public Health. How many years, Jolene? 15, 16 years?
I'm on my 15th year, 16th year would started in September.
Yeah.
Wow.
So 15 years of service to Lewis and Clark Public Health. And so, and she is not replaceable. She trained the previous health officer. And then when I took the reins here, she trained me. So there's no one like her and there's no one that will be able to replace her. We will hire her position, but it's just never going to be the same around here without her. So she runs this place. There is no doubt about it. And so we're wishing her farewell today, or allowing the board to wish her farewell today as well.
Thank you. No, in my opinion, if people haven't said, what are we going to do without you, then I haven't done my job.
You've trained us well, and we're going to be okay. It's just not going to be the same without you.
Thank you.
Well, I could say for certain, there's no way I would have made it through my 2 terms, Julian, without you. The message of when I was the chair was always, don't forget to ask for public comment. Say this, say that. Keeping me on task and everything else. And you've been just a pleasure to work with and
Well, thank you.
easygoing, and appreciate our relationship and our time that we've had together. And I wish you all the best in Georgia.
It'll be fun, I'm hoping.
Not far from the beach.
Doesn't
Nope.
Georgia have tornadoes and
Hurricanes.
hurricanes
Yeah.
and bugs and big bugs? Yes, and
But Savannah is usually just gets the skip of it. So, and I'm up a
Okay.
little ways from Savannah, so we're in Springfield. So we
Okay.
should be fine. I hope.
well, we all wish you the best of luck, Jolene.
Thank you.
All the best, Jolene.
Thank you.
Have so much fun, Jolene. It's been so much fun over the years. Thank you for all you do.
Thank you.
Yeah, enjoy the humidity for sure.
Yes.
It'll make your hair curly.
Yes.
Well, we all know we'll all look you up when we're out your direction.
Please do so.
Yeah, and I would just like to say thank you, Jolene, for running a tight ship and teaching me the ropes for the hearing officer and keeping everything in line for me. I don't know what I'm going to do without you. So appreciate
Welcome.
you and good luck.
Okay. Thank you so much.
All right. Well, that's a sad way to start the meeting
I know.
for most of us. I think a couple of people are pretty excited, so So we'll move to our action items. The first is appointments of Board of Health executive positions. So we have a couple opportunities here. We need to continue with
Oh, yeah, got
the chair of the board, and I believe our current chair has already stated she'd be willing to continue in that position.
Yep, I sure will. If you guys want me to.
Do we have anybody interested in becoming chair?
I think she volunteered.
I think she did, and so if there's no opposition, we will appreciate Bree's ongoing work as chair of the board. And then we have the vice chair, which is currently me, and I will also continue in that position unless there's anybody who would like to take over.
Don't look at me.
I'm just looking around.
I'm just saying, no. Okay,
All right, so we'll keep the same vice chair, and then hearing officer. Currently that's Lisa, and I did get some information that she too would be interested in continuing in that position.
Yeah, I'm happy to serve in that position if nobody else is interested.
she's fully trained. I don't think we can let her
Absolutely.
go because we won't have Jolene around to train her successor. So you're stuck with it.
Thank you, Lisa. And then representative to the Water Quality Protection District. Our chair has also offered to take on that position unless we have others that are interested. Very quiet crowd today. And so we will, I appreciate that, Bree. That's nice of you to step into that position as well. All right.
You bet. You bet.
Yeah.
I like it. It's great.
Great.
As a member of the commission, I get to attend those meetings too, and it is interesting. We've had interesting tours, haven't we, Bree?
All right. Well, I think
We have, yeah.
all the positions there.
Just, I would
But
do
let
a
me-
formal motion and a vote.
Could I have a motion to accept the nominations for the positions of chair, vice chair, hearing officer, and then representative to the Water Quality Protection District?
I'll make a motion to accept those board representatives positions for chair, vice chair, hearing officer, and water quality protection district of the following board members: Bree as chair, Dr. Bedell as vice chair, hearing officer as Lisa, and water quality as Bree.
Second.
Do we have any additional public comment or discussion by the board? All in favor? Oh,
Aye.
Hi.
Aye. Aye.
any opposed? All right, the motion carries. Thank you. So our next action item would be the soil displacement regulation revision. And I believe the board asked for a month of public comment, and I'm hoping, I don't know, Laurel, if you can rebrief us on what the changes have been.
Absolutely. Good afternoon, Mr. Chair and members of the board. I'm Laurel Reek, the Environmental Health and Disease Prevention Administrator. Last month, you opened the public comment for revisions to the soil displacement regulation for the East Helena Superfund site. The soil displacement regulation is designed to prevent contamination of remediated soils within the institutional control boundary. The changes proposed in the regulation will meet the new EPA standards and require a displacement permit when soil lead is at 400 parts per million, down from the 500 parts per million that it was. It will also require that replacement soil contain no more than 50 parts per million lead in soil. The cleanup action level has changed from 1,000 parts per million to 400 parts per million lead in soil, and we've updated definitions to match all of these changes. The draft regulations were posted for public comment. They were physically located at the East Helena City Hall, the East Helena Library, the Lewis and Clark Public Health Office. They were posted on our webpage, advertised with Facebook posts. The EPA did a press release on it, and the Independent Record read an article on the change last week. We have not received any public comment on these proposed changes.
Great. Is there any additional board comment? And so do we need another motion to approve
Yeah.
the changes?
And as a reminder, because this is a regulation, what the board will do is move to recommend for adoption, because it goes to the local governing body
That's right.
for final approval. So as you're preparing a motion, that's the language you'll need to use.
So I would appreciate a motion that we recommend approval of the soil displacement regulation amendments to approval to the local governing body.
So moved.
I'll second that.
All in favor?
Oh, public comment.
Oh, I'm sorry. Any public comment? All in favor?
Aye.
Aye.
Any opposed? All right, not hearing any, the motion passes and it's up to the governing board at this point. Thank you.
And Mr. Chair and members of the board, the local governing body is scheduled to meet at 3 p.m. today. The Zoom link is posted for public participation in that meeting on the public health website, and it was properly noticed 48 hours, the appropriate 48 hours worth of announcement occurred for that meeting as well.
Now, there is, well, I've heard through the grapevine that there is a potential for this to even go lower. So this would have to come back for recommendation again. Is that true?
Mr. Chair and Board Member Mergel, yes, if there are changes to federal or state regulations that we align our local regulations to, we would then have to come back and amend again. So we have both Beth and Laurel keeping very close tabs on any kind of changes that happen at the EPA or the Department of Environmental Quality. And then they would recommend it coming back to the board if and when that occurs.
Thank you. Thank you, Laurel. Moving to board discussion, we'll begin with a topic near and dear to my heart, chronic disease prevention.
And I believe Julie.
Julie.
Yep, Julie and her team are on
Julie,
today.
thank you.
Great. Thank you so much. I just lost track of my mouse for a moment here.
Even that happens.
My name is Julie Burr. I'm the Prevention Program Supervisor. I have a quick PowerPoint. I'll also introduce Melissa Baker, our Cancer Screening Health Educator, and Karen McLean, our Tobacco Health Educator. One moment while I lost my screens again. Okay. All right, and the slideshow, is this up?
It does, yes.
Perfect. Thank you. So we're 3 members of the prevention team, part of the Community Health Promotion Division here at LCPH. Just to recap why we're talking about this today, many of these topics we're talking about were part of the 2022 Community Health Improvement Plan. Among the various priority areas identified as health concerns in the county, we have asthma, cancer, heart disease, and substance use, but all tie in with what we're talking about today. And mental health and housing will, of course, always tying in as well. So I will turn it over to Melissa to talk about cancer screening and prevention.
Hello, excuse me, I'm sorry. Hello, Mr. Chair and members of the board. I'm Melissa Baker with the Breast and Cervical Cancer Screening Program. And I have been here about the same amount of time as Jolene, just about a year longer. So I'm coming up on my 17-year anniversary here in a month. So I've been doing this program that entire time. It's gone through a lot of changes over the years, but our focus has always been to provide free breast and cervical cancer screenings and diagnostic tests for women. I cover a 4-county area, so not just Lewis and Clark County, but also Jefferson, Broadwater, and Marr. So we provide those free cancer tests to women in those 4 counties who are uninsured or who are underinsured, meaning they might have insurance. They might have insurance, but it might not cover diagnostics or it might not cover their services in full. And they also need to meet income guidelines. So we're really focused on meeting, on assisting women who are on the lower end of the income spectrum, but we do have fairly generous income guidelines of 250% of the poverty level. And there are also some age guidelines that go along with the program. Excuse me, my voice is a little weak today. In addition to paying for the services on behalf of those women, we also, if a woman is in our program and she gets diagnosed with cancer, then I provide some patient navigation to assist her in getting Medicaid to cover her treatment. And we also work with United Way pretty closely and get some funding through them. And we use the funds from them to provide the free screenings and diagnostic exams for women who might not meet the age guidelines to be covered by the state funding. So the state funding starts paying for mammograms for women at age 40 because that's the national recommendation. But as we all know, sometimes women who are younger than that have some symptoms or family history that require them to get tested sooner. And so that's when we use those valuable United Way funds. I think that covers that slide. I also work on the, Montana has a statewide cancer coalition. And I have been the co-chair of the early detection implementation team for the last 6 years. So that keeps me busy too. The goal of the early detection team is to detect cancer at its earliest stages. And the way that we do that is through basically what my program is already working on. That's why it's such a great fit for me, to try to increase screening using nationally recognized guidelines for breast, cervical, lung, and colorectal cancer. So the scope of the early detection team is a little bit larger than just breast and cervical, as you can see. So we do also provide some, through the coalition, some education and screening promotion for lung and colorectal cancers as well. And our strategy is to promote screening through culturally appropriate education, inclusive education, and health equity approaches using one-on-one education, small media, and working directly with our target populations. And this last November, every year, the Cancer Coalition has an annual meeting where we all gather and come up with some goals for the coming year. And they have a little award ceremony. And this last year, I was awarded the Lupine Award for being consistent, having led the team for, like I said, for 6 years. Or well, it was 5 years at that time, going on 6 now. So. And over this last year, we did do a couple screening events. I collaborated with Leopoldja Clinic and the mammogram coach out of St. James Healthcare in Butte to offer a breast and cervical cancer screening day in July. I can't see the slide because of the way I have my things set up. But anyway, it was July 28th last year, so almost a year ago. And then we also partnered with Tough Enough to Wear Pink, which is a nonprofit out of Missoula, but they have a goal to screen as many women as possible across the state. So they kind of just do a blitz of advertising in October, and then we work with them to they do the advertising, and all the women in the Helena area call me and see if they qualify for my program. And if not, I can use the United Way funds, or we can use the Tough Enough to Wear Pink funds. So we did that last October. We're planning to do it again this year. Some of the women who call, like I said, if they get either enrolled into the program or they're covered with Tough Enough to Wear Pink. But if they have their own insurance, then that's just an educational opportunity for me to talk to them about insurance and the importance of cancer screenings. And I think that is it for my part.
Karen, I think you need to unmute.
Thank you, Julie. Hi, my name is Karen McLean, and I run the Tobacco Prevention and Cessation Program. And I'm just going to tell you a little bit about my program. So we have some main goals. The first one is to prevent tobacco use among young people. The next is to eliminate exposure to secondhand smoke. Then promote quitting among adults and youth. And then the last is to build community support and capacity for tobacco use prevention. And then the next slide, I'm going to talk about what that looks like on a daily basis. But I included a picture here. Oh, Julie, will you go back?
Sorry.
Here.
There you go.
All right. Well, this is a picture from last August at the Back to School Dash, which is put on by Peerview and Helena Indian Alliance. And this just gives you a sense of some of like what the events look like. This is Sarah Sandow, who's our division administrator. My daughter Nina, who was 5 at that time, and then my dad. So it's often a family affair. So I guess next slide. All right. So what does this look like day to day? One thing I love about this job is it's something different every day. I like that a lot. But some main things, main components of my work are, one is community outreach, like I just talked about. Tabling at community events is one of the main ways that we interact with the public and one of the main ways that we get out information about what we do. So summer is a particularly busy time for us. There's lots of community events. The weather is great usually, and lots of opportunities for us to participate. So for this summer, we have quite a few things going on. I think the next one on our list is the Peerview and Helena Indian Alliance Health Fair. That's going to be on the Walking Mall. We'll also do the St. Pete's Family Fun Fest this year. And then we'll go back to the Peerview Helena Indian Alliance Back to School Bash this year because it was just wildly successful. Last year, they served 800 students, which was just phenomenal. It's so, outreach has a ton of work, so it's really gratifying when you put all that work in and then you can reach a lot of people. And this year, it's going to be in East Helena at JFK Park. So I'm really excited to be able to go and be in East Helena. So some of the things we do at those events is it depends on what the event is, but we often have, I think you might have seen it in the previous picture, like spinning wheel, where we talk to kids and parents about chronic disease, and in particular tobacco prevention. And that really is a way to engage folks. And then we also have like pamphlets and stuff about the quit line and all the various different iterations of that for young folks, for American Indians, for pregnant women. So that is an awesome opportunity for us to reach folks and answer questions. So the next thing that is all as part of my work is the Clean Indoor Air Act investigation. And we are tasked with investigating and enforcing the Clean Indoor Air Act in Lewis and Clark County. And what that looks like is we will receive a complaint through the statewide system. So someone will make a complaint, and sometimes that's like an employee at a restaurant, sometimes that's a patron at a bar. It can be all different things, and it's often anonymous. And then what that involves is determining whether it is in fact a violation of the Clean Indoor Air Act. And then if it is, I do a site visit to the business that was cited. And I really make sure that that visit is cordial and friendly. And I really strive to make it kind of based around education and letting businesses know that I'm here as a resource for them. Often we hear business owners tell us, well, I knew that I needed to have signs, but I didn't know where to get the signs, or my signs are so old they fell off, or whatever it is. So that visit is, I really make a point of making that visit cordial. So I give them an official letter, education letter, saying they've been cited, what the consequences may be if they were not compliant and changing it. And then I provide a copy of the Clean Indoor Air Act, and then my business card. And I really encourage them to reach out to me with any questions. And I joke with Sarah and Julie that, my time will come when I have a really adversarial visit, but that has not happened yet. Folks are really pretty receptive, and it's a little nerve-wracking to go in, but I've always been really, a lot of conversations have gone. The next one is engaging youth. And so this, as I'm sure you know, is really an area of particular interest for us. We know that if we can get to kids earlier and earlier, there's less chance that they will start smoking or vaping. One thing recently that we did that I'm particularly proud of is we have a long-term relationship with PAL, which is the alternative high school. And I made an appointment to meet with the guidance counselor there to talk about how I could do a presentation to the students about, the My Life Might Quit, which is the quit line for kids under 18. And so it turned out that self-reported PAL students said that every single one of them either vapes currently or has vaped at some time. So we decided to kind of pivot, and so instead of going and kind of giving a lecture about why you shouldn't vape, which seems kind of irrelevant given the situation, we did a listening session, and I went with our communications manager, Amber, and we had a series of questions, and we spent the entire time just asking you, why did you start? How does it fit into your daily life? What is it? Have you ever considered quitting? And so it was really a great shift to let them be the experts and let them tell us how vaping is part of their life. So it was just very, I had never done anything like that. And it was just, they were very generous with their knowledge and their experience. And then we went back a second time, and based on the feedback we got in the first round, Amber and I mostly worked on a campaign around vaping, around not starting vaping. So, they were very straightforward about what they thought, which is what we wanted. And really, again, that was just, they were very generous with their time and their opinions. And the takeaway from that I'm really excited about, and this was their idea, was that they would like to be ambassadors to go into middle schools and talk to middle school students about why they shouldn't start vaping. Because we know from them and looking at the data that kids are starting vaping in middle school. And so, you know, telling high school students to not start vaping is a little bit kind of misses the boat. So I'm really excited about that. That's going to continue next year. Then the next one is, where am I? Building community. We collaborate with all different types of organizations, certainly other medical organizations like PureView and St. Peter's Health. We're always looking to find ways to collaborate and to get our message out. We also have more creative partnerships like Prickly Pear Land Trust. Tobacco-free parks has been something that's important to LCPH for a while, and we've been working with Prickly Pear Land Trust to have a non-smoking designation on some of the trails. It's not on every trail, but we're getting there. They did include it on the Prickly Pear Land Trust map for the year, which felt like kind of a big win. Of course, their focus on that is more about preventing forest fires, but we'll take it, right? It's still preventing smoking. And then the last one that I want to touch on is supporting local businesses. Again, like I said, during the Clean Indoor Air Act investigations, I really strive to make myself a resource for businesses. I want to make sure they have what they need, whether it's signage or anything else. We sometimes get calls saying, hey, I have patrons that won't, that will vape even though we have signs up, and, what can we do? So sometimes I'll provide support for them to just kind of talk through things. So yeah, that is the tobacco program, kind of the day-to-day work. I think we can do the next one, Julie. And then the last thing I wanted to share with you is my work with the Healthy Communities Coalition. This is something that I begged Sarah Sandow, Division Administrator, that let me take it over. It's really great. It has all different types of folks on it. And folks from PureView and St. Peter's Health and AARP and Pacific Source. And it's an opportunity for all of us to come together and, think about ways that we can promote healthy living in the community. There's also subgroups to the coalition. The most active one is Aging Well, and that meets every month. The Healthy Communities Coalition meets quarterly. And so that's it for me. I'm happy to answer any questions. Thank you.
I have a question.
Yes.
I have teenage grandchildren, and in visiting with them and their friends, I sense that they don't see vaping as tobacco use. And I'm very concerned about, oh no, they would never smoke a cigar or a cigarette, but vaping is okay. It's cool. It's this little machine. And I think it's really, and it probably has to do with the education piece of what you do, but it's so important that they know that vaping is tobacco. And it's not advertised as that. It's advertised as lemon peppermint or some ridiculous thing. But I'm just hoping we can push forward on the idea that vaping is tobacco use. And if you can think of some way I could help with this. I was part of the lobbying team that passed the statewide Clean Indoor Air Act many years ago.
Yes, yes, I know that.
And it's important to me still.
I would love to meet with you.
That's all.
Yeah.
Is vaping tobacco or is it just nicotine? It's not really tobacco, it's nicotine.
But that's a form of tobacco.
It's the ingredient in tobacco, but it's not tobacco.
Yeah, so the problem is that it has been marketed as kind of less problematic than cigarettes, right? That we even hear from students that, well, my parents don't want me smoking, but they want me to vape because that's, you know, not as bad. And it's also been promoted as something that you could do to stop quitting smoking cigarettes. But when we look at the data, we see that almost always that means that people are smoking cigarettes and vaping. And, you know, when we look at the flavors, like Commissioner Payne mentioned, strawberry shortcake, gummy bear, unicorn dream, you know, all of these things, it's very clear that, that it's predatory against children under 18 who are not supposed to be vaping. I don't think adults go into the gas station to buy gummy bear vapes. It's so clearly aimed, or maybe they do, but it's aimed at getting children hooked. So, yeah, Mayor Harris, did you have something?
No, I completely agree that they're definitely it's focus on kids. Also, I go to the grocery store and get gummy bears though.
I mean, I am a huge fan of let's be clear, but in terms of the flavors, it's just, you know, when the tobacco companies, the big companies say that, like, no, they're not advertising to children. I mean, that's laughable. It's so clearly targeted to children. So, Commissioner Payne, yes, I think we have a great opportunity to have some more awareness around vaping and how it is harmful to your health. And I would love to talk with you about that more.
Mayor Harris, the point he brings up is where the disconnect is, it's not tobacco. It's the chemical in the tobacco. And I think that's where the disconnect for our young people lies. And if the tobacco companies could be, you know, portrayed as lying to you and they're the bad guys and but the nicotine is it's the drug behind it. So talk to advertising people, but kids don't see it as tobacco.
Yeah, I agree.
That's all.
Thank you.
Any other questions for the disease prevention team? Ron, Steve. Thanks for all your work. Appreciate.
Thank you for the time.
Yep, thank you. All right, moving to the licensed establishment fee increase update.
Hello again. So our local public health is required to inspect licensed establishments in accordance with Montana Code Annotated. The purpose of any inspection is to verify procedures and to determine that facilities have adequate protections in place for public health and safety. Licensed establishment programs benefit local residents and visitors, as well as our new and longtime business operators. Inspections are required once per year by the local health authority for retail food facilities, wholesale food, public accommodations, and trailer court and campgrounds. Year-round public pools and spas are required to get 2 inspections per year, and there are 40 in our county. The National Retail Food Program standards state that food facilities should be inspected 1 to 4 times per year, and that's based on the level of risk of that facility. This would be for the 453 licensed food facilities in our county. This is not possible with current funding and staffing levels. Effective programs include plan reviews, inspections, training, technical assistance, follow-up activities, enforcement, and always creative ways to improve compliance. We have used in the past an annual food safety award for effective food safety systems and a pool award for water quality and safety systems. When funds are inadequate, our ability to provide these resources to the licensed facilities is diminished, and the public's health then is at risk. The establishment license fees are collected by Montana Department of Public Health and Human Services and placed in a local board inspection fund. Counties are reimbursed between 85 and 90% of the license fees if we complete at least 90% of the required inspections. All of our license fees are located in statute. making it very difficult to keep fees current. Most fee schedules for the state are located in rule that are adjusted through a public process and can be more easily reviewed to maintain an adequate level of service and funding. The license fees have not been updated since 2009, while costs to fund our program continue to climb. License fees currently fund around 17% of our program costs. Another 8% is funded through local fees for temporary food service permits, grants, and plan review fees. The remaining 75% is funded by local property taxes. Between fiscal year 2009 and fiscal year 2025, the portion from local taxes has gone up by 47% in Lewis and Clark County. I am currently sitting on a committee to evaluate methods to advocate for equitable fee increases during the 2025 legislative session. The license establishment fee increase fact sheet is found on page 22 of your board packet. This was developed from this committee work. The committee is going to be working on and continuing to work on identifying an equitable fee increase proposal. We are currently looking at adding categories that will have larger facilities paying their share of the program costs more equitably. We are also organizing listening sessions in communities that would include our operators, the National Restaurant Association, the Montana Taverns Association, the public, and political leadership. We cannot continue to do the required level of work without added financial support through increased fees. I would be happy to answer any questions about this.
And Mr. Chair, members of the board, I'll just add, thank you, Laurel, for that summary and that presentation that maybe Commissioner Payne would be willing to jump into, but MACo, the Montana Association of Counties, has heard multiple presentations about this issue and will be considering putting this on their legislative agenda. So we're really hoping that MACo will come alongside this conversation and support advocacy for fee increases. Those conversations have been going on now for several months, so which is really exciting to have MACo's support.
Well, Mr. Chair, MACo has also gotten kind of crossways with the executive branch. And the theory is anything MACo supports this session is probably going to get shot down by the governor. So we'll do the best we can.
So strategically, maybe I shouldn't say that out loud then.
And that's exactly, I was just thinking strategically. Another thought I had that does not go with the common theory of increasing the fees is 75% is paid through our property taxes. And you know, the licensed establishments aren't the only one that benefits. Each of us do, because we count on.
Yeah.
So I'm not sure that it's, yes, I do think that fees could be increased, but I also don't, I think the 75% to the property tax, the people who use these licensed establishments is, I can see some equity in us, the users of those licensed establishments, helping to pay for it. It's protecting my health, my children, everybody. So just a thought.
Well, when I look at the numbers, certainly for, you know, the large businesses, by modern standards, these are pretty low fees.
They are.
These are very small numbers. So.
And what when we started pulling these numbers together and putting them on paper so that we can talk more intelligently about this and consistently across the state about this, what became very evident is that all establishments, regardless of size, are paying the same amount. So a big Costco pays the same amount as a small coffee shop. So looking at that, evening that out a little bit, lessening the burden to the taxpayers and evening that out a little bit. So, and really trying to find messaging that resonates with both operators as well as residents, property taxpayers. So I think the listening sessions will be very helpful. And so as soon as those details come out, we'll make sure that the Board of Health knows that those are happening so that you can participate. And then as we grow closer to the session, we'll bring this back again to the Board of Health for potential action by the board. So, considering the board will have an opportunity to consider what role that you all would like to play in the advocacy of this. So
another thought I just had is that the people who use the services, whether they pay it through their property taxes or an increase in their grocery bill out at Costco, we pay for this one way or another. And I'm sure the businesses will pass the cost on to the users, whether it's a swimming pool or food program. So, and it's to benefit each of us in our way of life through better health. And this is something, it's kind of like telling people that your taxes are going up because we got to buy a new road grader to fix the roads. We expect to have our roads fixed. We expect to have our swimming pools clean. And if this is the quality of life we expect, then get out your checkbook. You're going to have to pay for it.
Any other comments for Laurel? Thank you, Laurel. Appreciate your work on this issue.
Yes.
Thank you.
All right, communicable disease response plan.
Nina's with us today to do the.
Hi, Nina.
I've got myself unmuted. Let me see if I can turn my camera on. Hold on. There. Are you seeing my slide here?
Yes.
Okay, great. Good afternoon, board chair, members of the board. I'm Nina Heinzinger, the licensed establishment supervisor. I'm here today to provide an overview of our communicable disease response plan and report the changes that we've made recently to the plan. This is a requirement of our Public Health Emergency Preparedness Grant that we have from the Department of Public Health and Human Services. Hold on here. See if I can make this work. There we go. Local public health is the heart of the U.S. public health system. We coordinate and advise in response to disease threats within our local community. Our partners, who are both large and small, look to us for guidance in public health matters. We are in contact with these partners, providing information to keep people safe from disease when there is a risk to public health. We work together to protect the health of our community, especially those that are most vulnerable. We'd like to touch on your role as the Board of Health. So the Board of Health is important to know and have some awareness of the strategies that we have in terms of communicable disease response. And there are certain strategies that, if we implement, require board approval. Also, we are required to have an annual review of the response plans as part of the Public Health Emergency Grant. And local public health has actually been around for a long time. Looking up a little bit of history, since the 1790s in our country, local boards of health in Baltimore, Philadelphia, New York, Petersburg, Virginia, Boston, Massachusetts claims the first established Board of Health with Paul Revere as their first health officer back in 1799. So boards of health go back a long way. And concerns back in those days were drinking water quality, sewer construction, marsh drainage, internment of the dead, tree planting, and vegetable growing. Guess what? Many of the same concerns that we have today. And one of those concerns is communicable disease. And this plan that we have presented to you, the purpose of this plan is to define those procedures within our community that we will respond to communicable disease incidents. And this includes starting with a single case of communicable disease and increasing the response for an outbreak or escalation of a communicable disease to a communicable disease emergency. This plan directly supports our mission statement to improve and protect the health of the Lewis and Clark residents. And we have actually made this plan available on our website under Public Health Communicable Disease Control. So anyone has access to the plan. So you can look at it as well as any of the public. So what does our plan consist of? In terms of our plan, one of the main parts of our plan, and a very important part, is surveillance. Finding out where there are problems in the community. And this can be both active and passive. So active surveillance is when we're reaching out to various providers within the community, conducting site visits to review reporting, soliciting reports on communicable disease activity, and sharing a communicable disease summary at least annually with the community. And this is mostly the work of our public health nurses who work with our local providers. Then in case of passive surveillance, this is reports that come into us. So cases of reportable diseases received from the healthcare community and calls directly received from individuals reporting illness as well. And these can pour in a variety of different ways, both through our main phone number, into licensed establishments if they involve a restaurant or a public facility as well. So what happens once we hear about a case? We have a variety of different ways that we investigate illness, depending on the illness and the agent that may be involved. We want to prevent and limit the spread of communicable disease in the community. This includes a variety of disease control measures. So we are going to, it'll depend upon the disease. We seek to use the least restrictive disease control measures that we can in terms of preventing the spread of that disease. So when we're talking about communicable diseases, we're usually talking about diseases that can be spread throughout the community. The control measures include education, isolation during the period of communicability, exclusion or restriction for those in sensitive occupations. Someone who's a food handler, we don't want them handling food while they are able to spread that disease. Daycare providers, individuals working in our congregate care settings with our most vulnerable populations, such as nursing homes. And then we also work with congregate care settings, such as nursing homes, schools, daycares, to make sure that they have the necessary information to limit the spread of disease within their facility. This can include education, use of our health alert network, and exclusion of children from daycare when symptomatic with certain diseases. So here we've started, we've received some reports, and then we move into outbreaks. So when we talk about a cluster or an outbreak, We identify it in several different ways, and these are all identified within the communicable disease response, but I just want to give you an idea here. We may see multiple disease reports of the same agent found within a very short time frame. Our Montana Public Health Lab and CD-EPI may identify clusters by whole genome sequencing of samples that are sent to them. And this usually is involving national or international outbreaks followed through CDC or the World Health Organization. We may have 2 or more people who experience a similar illness after ingestion of a common food or meal. And then multiple complaints received identifying a common source. Or in some cases, we will have an outbreak response if it's a single case of an unusual communicable disease, such as measles, Ebola, or botulism. When we confirm a case, we will start to confirm an outbreak by conducting initial interviews to determine the potential number of cases and sources. So through these interviews with individuals that have the disease, have been identified, we're going to look for common sources of exposures and initiate additional lab testing to identify the agent of concern if the individuals have not been tested for an agent yet. Depending on the outcomes of those interviews, we'll usually convene our outbreak control team, the EPI team, and it'll be based upon the scope of the outbreak. So the team can get larger or smaller. Sometimes it's only a few of the sanitarians. Sometimes it expands to the Board of Health, just depending on the scope of the outbreak. This meeting would design a response plan to the incident. It could include designing questionnaires to try to identify the source and additional cases. We would communicate with providers through the Health Alert Network as well to see for additional cases and analyze the data. Our epidemiologists would look at the data to also help identify possible sources. And in the case of an outbreak, then we're going to implement appropriate control measures to prevent the spread, which might include anything from treatment for those individuals, education and prevention messages, contact notification when appropriate, and then also, if necessary, limiting movement, the least restrictive response to protect the community. And that would include something like having ill food workers excluded or restricted from work, or daycare providers, so that it's not easily spread. But sometimes, as we know from recent history, circumstances can escalate when we have a lot of cases, or different circumstances arise that lead to the activation of the incident command system and the public health all hazards annex. And we're going to see this public health emergency when we are having to have staff called out after hours. We're not able to provide our regular routine services because staff is dealing with increased call volume, an increase in cases or clusters that have to be investigated, and staff is being reassigned from their usual tasks to help out with in that case. And that can actually lead, the public health emergency can actually lead then to a community-wide response. And this is something to keep in mind, that when we have an emergency declaration for, we're able to access a variety of different resources. Resources can be released, including the National Guard, there's state and federal caches of vaccines, personal protective equipment, countermeasures, as well as funding to help out in cases when there's an emergency declaration, when the resources are beyond what we can do here at the local public health level. We also have operational plans to support this response found in the attachments to the CD plan, the communicable disease response plan. I know that the communicable disease response plan is fairly lengthy, but we do include a variety of different subplans within that for reference, depending on the emergency that arises. This plan includes the emergency medical countermeasure plan for strategic national stockpile and the mass prophylaxis, a non-pharmaceutical intervention plan, which includes isolation and quarantine when needed, and the pandemic flu plan, which is actually a federal requirement that we have it within our communicable disease plan. So it does refer the reader back to our communicable disease response plan as well. So hopefully at some point we reach an outbreak resolution. So hopefully the outbreak comes to an end. We continue surveillance to document that the disease incidence is under control, or that the disease is no longer present in the community. It really depends on the agent when we're looking at outbreak resolution. We will usually follow up with an outbreak report, especially moving forward, so that we can learn from our experience and look at our response plan and incorporate lessons learned as we go through that response plan. And that's recently what we did in terms of our response plan, was look at it and review it. And that led to some plan updates for the year. We did update the frequency of the active surveillance activities, do some clarification of various points within the document to make them clearer, as well as added descriptions and specific actions for congregate settings. There was some change in regulations for congregate settings, and we added a variety of different links for resources to complete that response. So we did revisit the plan extensively last year, and then this past year, just more minor changes in terms of that response plan. But this is our guide to responses to communicable disease here in Lewis and Clark County to protect our residents. We want to make sure that residents are safe from communicable diseases and hopefully limit the spread of any diseases that do appear in our community. So with that, do you guys have any questions for us today?
Thanks, Nina.
Go ahead.
Sorry, Justin.
Sorry.
I was just going to say, I appreciate having dealt with recently some other, not communicable disease outbreak, but a waterborne disease outbreak in a community that did not have an emergency response plan. So I appreciate all the work that goes into planning for these, and may we never have to use it. That's great. But when you do, it's ready to go. So kudos to you for always taking a look at it and updating and being prepared. That's what it's really all about. So thank you for that.
I was just gonna say the same thing, having that plan as we've looked through, as Peerview's looked at other counties and stuff and supporting other counties. One of the things we look at is what the communicable disease plan is, and most people, it's just a phone number to call. But this is clear and outlined, and thank you again, just like what Board Member Lisa's saying, is it's nice to have, and it's a good go-to, and it was really good to have during the that COVID time. So well, I greatly appreciate it. Thank you.
It did definitely get tweaked after COVID, you know, more so last year than this year, more just minor edits, but it really serves as a guideline to those of us that are doing communicable disease. And we do have two teams that do communicable disease here in Lewis and Clark County, both the licensed established sanitarians and then the public health nurses, depending on the disease. Obviously, if it's an outbreak of salmonella, it's going to land in the licensed establishments because it's usually traced back to food. So we're going to work with those individuals and try to figure it out. It is nice to have a guide, and it was nice when I came here to Lewis and Clark County to actually have written out procedures and then been able to tweak them a little bit over the last couple of years. So.
And as Nina mentioned, it is a lengthy plan, so it did not get printed in your packet, but it is accessible on our website for any and all to peruse through at your leisure.
Go ahead.
We have a gentleman named Kyle Sturgis.
Sturgill Simpson.
Yes, thank you. And he is head of our disaster and emergency services. And although what he oversees is mostly floods and earthquakes and forest fires, I can see where it might be the interests of public health, including communicable diseases, could coincide with the approach that Kyle takes in his DES organization. And I'm thinking this is part of the DES plan, or?
It is. The emergency operations plan for the county includes a public health annex.
All right.
Yep, absolutely. And any kind of an emergency response that we engage in, we always pull in department or the disaster and emergency services office.
Okay. And do they pull you in?
It depends on the topic or the emergency. Public health is always engaged when there's flooding. We're always engaged when there's wildfires. So it depends on the emergency, but most often there is a touch point with public health in some way.
Okay, thank you.
We are really good partners. Yes.
And Brenda, can you remind me, I don't know if this impacts this, but with the formation of the local governing body and some of the changes for the health officer, how does that
Yes, so,
impact this?
and I have my legal backup behind me if I get this wrong, but when that new law was passed back in the 2021 legislative session, it did change regulations where the Board of Health has to essentially make recommendations for approval by the governing body. There is one exception to that, and that's in case of public health emergencies. The department can act in an emergency, and so can the Board of Health act in an emergency. And then once we've acted, then the governing body has time to come in and say, we need to make adjustments to this, or we're going to repeal it. But there's at least time for us to act first, and then the governing body can then come in and see what's going on and see if there's adjustments that need to be made. How'd I do, boss?
That's great.
Okay.
I have to slip out. Pardon me. I'm sorry.
Thank you. Thanks for that clarification. Any other questions?
Just going to point out with the mention of Kyle that we did recently have a tabletop practice with a foodborne illness, and Kyle joined us on that along with some of our other partners in terms of testing out our communicable disease plan. So we do test it as well.
Mm-hmm.
Any other questions for Nina? Thank you very much.
Thank you for your time.
Great. So that concludes our public agenda for today. Do we have any public comment from any of the items on today's agenda?
While Jolene looks, I just would like to make an announcement to the board that we are going to cancel our July Board of Health meeting. So some are short, and there's some conflicts that have come up And it will also give us an opportunity to get Jolene's replacement hired and some training. And then also Justin's replacement on the board. We'll be able to do orientation in the month of July. So the next board meeting will be our regularly scheduled meeting in August. So look for that cancellation to come through.
Thank you.
That's probably Jolene's last official act for the Board of Health is to cancel your July meeting.
If I don't forget, but I won't. And no public comment.
Great, thank you. So we will now, there's no public comment. We'll close the public session and go into a closed session for the health officer annual appraisal.
Okay, and give me a moment to transfer the host to Drenda.
Okay.
And then not sure if you want to continue with recording, but if so, you'll need to stop the recording then also.
Okay, thanks, Jolene.
Mhm.
And then Commissioner Shirtliff, do you have your link for the local governing body meeting that will start at 3?
I'll be there in person.
Oh, that's right. Okay, we'll see you when you get here then.
Cool, thanks.
Thank you so much. Thanks for listening in to the Board of Health meeting. I appreciate that.
Hey, you bet. All right, see you at 3.
Interject
Yeah.
really quickly.
Yeah.
Just, I'll also step out, but I just wanted to let the board know that if you're going to go into a closed session, you have a motion, a second, and maybe some discussion on the record that the privacy interests are going to outweigh the public's right to know for the purposes of that meeting. And then I don't know how you guys have it set up, but everything still needs to be recorded because you guys are still a quorum body. And so that still needs to happen. So any of the minutes in those discussions still are also protected by that privacy interest, but there's the requirement to still keep minutes or notes of the meeting exists even when you go into private session. So
thanks. That's we got a little training.
Yeah,
from
that
legal
was great.
counsel.
Yeah.
Thank
So,
you.
Yeah, absolutely.
We'll do that
Yeah.
correctly next time.
No, and we're doing the governing body here, right? Yeah,
at 3.
perfect. Yeah.
Yep, yep.
Okay.
So make yourself at home.
Yeah, no, I will. I'll wander around. Thank you guys
Thank
very
you.
much.
I am gonna stop recording and then just take notes. So.